Hi, I'm Carrie and I will be discussing lupus. So, basically lupus is a chronic autoimmune disease and it happens from basically what autoimmunity is it's when your body can't tell when your body's immune system can't tell the difference between organs and tissues and foreign invaders, which that's viruses, bacteria, your basics. And lupus can damage any part of the body and any organs in the body. Hippocrates was the first to study lupus, or Hippocrates was the first to document lupus in the 400 BC, and lupus was which meant wolf, was defined because the rash that people would get right here looked like a wolf bite, and many would in the 4th century would misdiagnose lupus and thought that it was an STD, and also then to continue on in the 18th century, people began to believe that lupus was caused by tuberculosis, which wasn't true. And then later on into the 19th century, they finally figured out lupus was lupus and, autoimmune. And it was broken up into 2 specific kinds of skin diseases, one being lupus erythematosus and one being lupus vulgaris. Also in the 19th century, Dr. Willen found that lupus should be broken up into 3 categories, one being lupus that destroys on the surface, which would be cutaneous lupus, and then one destroying in depth, which would be lupus erythematosus, and then one being the kind that lupus with hypertrophy, which would be the kind that which would be drug-induced lupus. And also then they found later on in the 19th century that immunofluorescent microscopy was used for the lupus band test, which was to see if you had lupus. To begin with, there's different types of lupus. There's systemic lupus, which is your most common, and that one attacks any part of your body or any organ. And then there's cutaneous lupus, also called discoid lupus, and it's just the one where you get lesions and rashes, typically on your face or cheeks. And then there's drug-induced lupus, and that one is normally a lupus-like disease that is caused from a certain medication you might be taking, prescription drugs. And then there's neonatal lupus, and that is caused, it's not really the true form of lupus, and it's very rare, but normally it's when the mother, she has lupus herself and she's carrying a baby in her womb, and then her antibodies start attacking the baby who's in the womb, and so then it causes the baby to have lupus. Prevalence and transmission. So it's most prevalent among women, especially colored women, and ages of 18 through 34 are most prevalent for getting it, most susceptible, and the countries that have it the most is Brazil and Venezuela, which are in South America, and the minimum of people who have it worldwide is 5 million. And also, lupus is untransmissible because it is an autoimmune disease. Prevalence and transmission. So it's most prevalent among women, especially colored women, and ages of 18 through 34 are most prevalent for getting it, most susceptible, and the countries that have it the most is Brazil and Venezuela, which are in South America, and the minimum of people who have it worldwide is 5 million. And also, lupus is untransmissible because it is an autoimmune disease. Okay, so what organs, tissues, and cells are affected by this disease? Well, there's your nervous system, which the antibodies, they bind to your nerve cells and that feed them, and they can interrupt the blood flow, which means, your hands, they go numb, and then, yeah. And many patients with lupus experience fibromyalgia, and this is increased sensitivity to pain. And then with your ophthalmological system, that's your eyes, and it can change the color of the skin. It can change like the skin around your eyes and make it like more scaly. Dry eyes are a common experience, and it can cause an inflammation of the white outer layer of your eyeball, which is also known as cellulitis, and it can also cause poor eye movement. And then for your dermatological system, you already know that like it causes, you know, rashes, lesions, and then with your cardiopulmonary system, it causes like pericarditis, myocarditis, and endocarditis. And all of those are basically just inflammation of different parts of your heart. And so basically, you know, you could have problems with that too. And and also like heart disease. And then with your renal system, that one is experienced with patients, and like in a lot of patients, and it's probably one of the worst things because it can cause kidney failure basically at the end, and then a lot of people end up having to get kidney transplants. And the reason why is because there's something called lupus nephritis, and that's when it causes inflammation of your kidneys, and normally a common symptom is blood in your urine. And then it can also cause kidney infections because of the meds you're on, and you know, because your immune suppressants, and then it can cause thrombitis, vasculitis, and lupus cystitis. And yeah. Okay, so macromolecules and enzymes involved. So there's your autoantibodies and autoantigens, which are proteins. And the autoantigens are known as CD20, and they're proteins that are part of the cause of lupus. And then overproduction of the lymphocytes, T cells, and B cells cause cell signaling problems because within your paracrine system. And then, however, they do have a medication known as rituximab, and that's a chimeric monoclonal antibody, and it can help to reduce the number of B cells that by binding CD20 cells, and that's also known as basically immune suppressant. Time sequence of lupus, which is also, I'm also talking about systemic lupus for all of this, so just, yeah, FYI. But patients are susceptible to relapse and remission, and when on rituximab treatments within 6 to 9 months, within the 6 to 9 months, it depletes the amount of B cells that are being produced in the patient, and it works in about 80% of patients. And it is believed that 10 to 15% of people with lupus will die early from the disease. However, because of medicine getting more advanced and everything, the majority of people with lupus will continue to live a normal lifespan unless they're untreated. If they're untreated, then they'll probably die young. Lastly, the major signs and symptoms of lupus is fatigue, painful swollen joints, headaches, fever, and butterfly-shaped rash on your cheek and nose, like we talked about, and the hair loss, blood clots, anemia, and Raynaud's syndrome, which is where you experience numbness in your toes and your fingers. And then there's also sores in your mouth and nose. And yeah, that's it. Thank you.